Stuart McGill, you are the back mechanic. You're here to fix our backs with evidence based science. First of all, very simple question, but likely very complex. Does back pain always have a root cause?
Back pain is a symptom that has many, many different pathways. There is a tendency among some that if they cannot find a specific cause, they believe it's nonspecific. So my first answer to the question is no, nonspecific back pain in our world doesn't exist. There's always a cause. Now we can get into a discussion, if you wish, on the many different pathways that end up with a person reporting the symptom of back pain. There's always been a lot of discussion on the relative contribution of the biomechanics, a tissue being damaged, a nociceptor pathway to pain, and then some of the psychosocial aspects of how a person perceives their pain, their fear around the future, and this sort of thing that modulates their pain behavior. All of these things are considerations.
Yeah, I mean, so given there are so many different causes of back pain, from direct tissue injury, inflammatory causes, neurological causes, what do you think is the biggest thing that the average person is doing right now that's really worsening their back health?
All right. Well, I'm going to have to go to several scenarios here. Let's take a 30-year-old male who has a job in front of a computer, and then at night they are very diligent with their fitness, and they go to the gym and they'll do some heavy weight training for an hour. That person's pain, most of the time when we see them, will be what we call discogenic. The training may not be with sufficient form. They're creating cumulative stress on the disc. Now, is it the disc that's causing the pain? Not necessarily. It is an overload of both compression and moving the spine that might create a little bit of a disc bulge. That disc bulge in turn sets off an inflammatory soup that might irritate the nerve, or it might bulge and mechanically contact the nerve. And now they've got not only back pain, but pain into the gluteals, pain down the leg, and where it goes down the leg informs us of what route we're talking about. Now, interestingly enough, they will report that sitting, their job, increases their symptoms, but getting up and going for a walk takes their symptoms away. So that would be the most common among that demographic. But now let me switch it over a little bit. I don't know how old you are, but I'm getting pretty close to 70 now. And I would have those pains as a 30-year-old, but I certainly don't have them now. By the way, I don't have any back issues. However, if someone like me came in here, they are most likely to report sitting used to cause their pain and walking would take it away. Now they say, now the opposite has occurred. Sitting is a reliever of my pain and I can only walk so far. So same person, a few different decades. So that would be the more common pain pathway of that demographic.
Why does that happen? I mean, you've seen the discogenic phenotype is more common in that 30-year-old scenario where they're weight training and there's cumulative stress, and that pain pathway is triggered by impinged spinal nerves, basically, and this sort of bulging of the disc in and out like a hernia. But in this older population, 60 plus, that same relieving factor is now an exacerbating factor. What has changed in their physiology? Because they've still got this disc herniation potentially. So why is now sitting better?
Perfect question. I'm going to show a model now, and for the people who are only listening, it's a physical model, a highly biofidelic model. It's produced by a group called Dynamic Disc Designs. But nonetheless, what I'm showing is a lumbar spine with 3 vertebrae and 3 discs. The top and the bottom discs are uninjured. Let's say this is the typical 30-year-old. But the L4, the disc in the middle, has been damaged and it's lost stiffness. Well, some people hear the word stiffness and they get all bent out of shape. Stiffness is just like having mass or viscosity or any other tissue property. It is its ability to resist an applied movement. The bigger the movement, the less stiff it is. So I'm now applying a torque or a motion perturbation to a spine that has a damaged disc, and you see the very large, disproportionate micro movements occurring at the level that has an injury. That in a 30-year-old will cause acute attacks. Every few months, they will just bend down to pat their dog or put on a sock, and they say, well, I had an acute attack, and they wondered what was that all about. Usually, it's a micro movement that has triggered could be a disc bulge or the inflammatory soup that we were talking about earlier. But your question was, what changes? Well, look at the level where the disc that has been damaged is. Now, there's 3 joints at every level of the lumbar spine. There's the disc itself, and then the neural arch, which protects the spinal cord and the nerve roots and creates attachments for muscles and ligaments, are bones in the back. And you can feel those bones as you run your finger down a person's back. Behind there are 2 articulating joints. So there's 3 joints to every lumbar joint, shall we say. Look at the motion that is occurring at those bony joints at the level of the disc damage. They are performing much more of the work versus the level above and the level below. Well, the body's reaction to that usually, if the work is excessive, now it's the damage that's focused the stress to the facets at the level of the damaged disc. You can see how they will become arthritic much sooner than the joint above and the joint below. So now when they move backwards and extend their spine, that will become, the bone literally looks a bit gnarly. That's the best word I can come up with. The rootlets that exit that level come through a hole called a foramen. Bone grows around that foramen. Inside, where the spinal cord is, the ligaments thicken up. The ligamentum flavum typically will thicken. The facet joints growing makes the hole smaller. So people will have the diagnosis, spine stenosis, which simply means a narrowing of. So it might be an arthritic encroachment from bone. It might be a thickened ligament. There tends to be some vascular congestion as well from the inflammatory soup. So that's the cascade accounting for a 30-year-old through to someone my age now, where the instigators have changed.
So we've seen skeletal remains from prehistoric humans show signs of degenerative spinal changes like osteoarthritis, which you just mentioned, herniated discs, which we've covered as well, and even the Neanderthal remains as old as 50,000 years of old have actually shown changes associated with spinal wear consistent with chronic back issues, even way back then. So that just leads me to question, is the human back just designed in such a glitchy way that we are just prone to pain regardless of whether we're seated too long or we're doing excessive activity, and why?
Yeah, it's a fabulous question that my academic colleagues and myself have discussed at length. Interestingly enough, I believe it was the BBC a number of years ago who they were creating a documentary on if you could redesign the body, if you could play God, how would you do it? So they went to a knee specialist, a brain specialist, a neurologist. Anyway, they came to me for the spine. And this was my answer. I don't think I could redesign the spine any better to be more resilient and high functioning. And here's why I said that. Think of the demands you place on your back. You need to bend and be pliable to tie your shoes. procreate and have sex. You have to lift a heavy weight. Say you are a Neanderthal and you've shot an animal or speared an animal, more likely, and now you're carrying that back for your clan. So now having a very flexible spine won't bear heavy weight. You needed musculature to stiffen that very flexible rod to allow you to bear load so it just didn't buckle and collapse like a willowy rod. So this is so interesting. When we look at a person, let's say, choose the person who has the world's record for performing consecutive sit-ups. Do you think they have a slender spine, one that bends very easily, or do you think they have a thicker spine on the human spectrum?
Yeah, probably thicker, I would say.
Okay, dead wrong.
Okay.
If you take a thin willow branch and bend it back and forth, there's no stress. If you take a thick branch and bend it once to the same level, it shatters because the bending stress depends on the thickness of the rod. But now I'm going to flip the question over and say, which of those two anatomical architectures, the slender rod or the thicker spine, bears compressive load? The thicker
one,
the spine, the more compressive load it can bear. So do you see how you can't have it both ways? There's always a trade-off. So when we look at the various trade-offs and the demands of what the person must do together with carrying out body functions, it's very hard to redesign a spine. So what we're left with is a linkage, the skeleton, where competent movement distributes a blend of stability and mobility throughout the body. So we know that if a person has a stiff hip, now optimal mechanics of a linkage require the hips to be very mobile. That de-stresses the spine. But if they have a arthritic hip, the motion now that should have been in the hip goes to the spine. The spine has to give up some of its controlling stability to enable the mobility. Now, the next print, do you know what a backhoe is? The JCB is a very popular loader backhoe tractor in the UK.
Yeah.
On the back of the tractor is a backhoe. I have one, actually, so I operate these. The first thing the operator does is put down stabilizers, which lift the rear tires off the ground. That's called proximal stability. It locks the linkage, this skeleton basically, into the ground. This is what your core does. It creates stability, sacrificing mobility to lock the core down. The hips are like the shoulder joint of the backhoe, and then there's the elbow and the wrist. If you want to pull dirt with the backhoe, you had to lock the tractor down. Otherwise, the arm, the distal athlete, would just pull the tractor around. So in order to move, if you create proximal stability, it allows you to transfer the power through a stiffened core and allows you to throw a ball, kick, throw a spear, run, and these kinds of things. If you compromise that distribution of stability and mobility, you're creating stress concentrations that will cause cumulative damage and eventually pain, or you will have non-optimal performance. So does getting back to evolutionary development of the human form, the knee is designed perfectly for what we've evolved to do. And I'm going to argue so has the spine. However, the system must work and the person must have movement competency to follow those rules and live a life without creating a stress concentration and pain in any part of it. So I don't think we can redesign the spine any better.
So we've been cursed with dodgy backs, but evolution has also blessed us with the sweet spots of stability, function, mobility. But the trade off there is some degree of pain, chronic pain, orthopedic back diseases for that diverse functionality that the human back has. So, we that's what we have to deal with. But the question also I'd want to ask on the back of that is, why is it so that people more often suffer with lower back pain rather than middle or upper back pain? Is that purely a mechanical tension compression issue because the lowest point of the body is exposed to the greatest vertical compression pressure?
Well, I think you're correct, Karan. Not only is it compression, but it is the majority of the movement is when you look at the spine, unless a person has, developing kyphosis or something like that. It's also the thickest part of the spine. So it is the easiest to herniate. I'm going to show a model now, and you can see the vertebra. The inside of the disc is a gel. It's actually a hydraulic structure. The hip joint is a ball and socket joint, which is made to produce large forces and power through a very large range of motion. Some people think their spine is a ball and socket joint, and they treat it that way, which is a problem. The disc is actually an adaptable fabric. It has many collagen fibers, type 1 collagen for strength, type 2 collagen for elasticity, the reciprocal of stiffness, shall we say. But the third type of collagen binds all those fibers together. Now, if you have a very thick disc, so a very heavy skeleton, and you bend forward, the bending stresses on the outside of these collagen fibers are much higher. So that takes me back to that argument of, if you want to do a lot of sit-ups, it might be fine if you have a slender spine. It wouldn't be the way to train a world-class strongman, and I've worked with a number of them, and I don't know one who trains a sit-up, but I do know more slender types of spines that do, and they get away with it. If you look at the Olympics, it's so interesting. The winner's podium of every sport. Look at the hammer throwers. The first, second, and third place hammer thrower looks somewhat similar, which looks very different than a shot putter. Looks very different to a swimmer, a wrestler, a gymnast, and the reason, a sprinter versus a 400 meter or a 10,000 meter. What we have been given gives us mechanical advantages and disadvantages.
So if someone is listening to this right now and they have mild back discomfort, which they've just put down to the stresses and wear and tear of everyday life, the kind maybe you barely notice, but it's a low-grade back pain that someone lives with, it doesn't interfere with their quality of life or function to any significant degree, is that still a cause for concern and then a potential trigger for them to actually do something about that pain?
Well, my answer is I don't know for that individual. But to give some context to that, by the end of our time together here, in which we've both been sitting, my hips, my back has had enough. I'm going to migrate the cumulative stress by standing up and going for a walk. Or, I've trained myself for over 50 years now. I'm going to go and have a training session to get rid of the pain. So you can do anything you like, and it will eventually cause pain. Let me really give a poignant example. We put students to bed for 36 hours. We measured their spines swelling. And we got the original idea from space travel. A lot of astronauts, their spines swell once they leave the gravitational compression of Earth because the discs are hydrophilic. They're sucking up fluid. If you lay in bed long enough without changing posture, you will get back pain as your spine slowly swells. Now, the optimal amount of time to lay in bed, on average for most people, is 8 hours. If you stay in bed longer, if you've had the flu or something, people will relate to this, your spine goes into a compressive overload as the turgor of the nucleus inside the disc swells and gives bone pain. All you're doing is laying in bed. If you ignore that discomfort, it will then go to pain. If you don't move and stay in bed, that pain will then become an outright injury. So you started with discomfort, you went to pain, and then injury. What's the injury? Well, the first injury is called a bed sore, and all you did was lay in bed. So is that an example of we're made to move, we're a dynamic machine, failure to move is going to eventually lead to pain and injury?
Now, that's obviously one extreme where totally agree. I mean, we're made to move, and this sort of, movement is lubrication, as people like to talk about. But on the other hand, exercise, obviously, on that same strand, exercise is good for us, but there may be some types of exercise, if performed badly, can be detrimental for spinal and back health. One exercise which, depending on who you ask, may court some controversy would be the deadlift. And there are various types of deadlifts. But if you think about traditional deadlifts with a barbell in front of you, or even a trap bar deadlift where you're inside the bar, you are still picking up heavy loads. And there's obviously some compression of the spine happening at that point. There may be some increased spinal flexion depending on how you maneuver the weight as well. I've heard someone say, in fact, many people say, that there is no advantage doing heavy deadlifts unless you are training for a powerlifting event or you are a professional athlete in a certain sport. For the average person looking to just improve their general health, keeping control of their spine, heavy deadlifts are higher risk than they do provide reward. Is that something you'd agree with?
I'm not going to agree with anything in a blanket application because I've worked with many powerlifters who have set world records in different divisions and in different organizations, in the deadlift, in the squat, in the bench press. There's pictures of people on the wall here who have world records in the IPF, the very strict powerlifting world. But I think your question was right down to your listenership. The idea that the deadlift is used by trainers, it depends on what their goal is. If they are trying to teach a hip hinge movement mechanism, so I know some of your people are only listening to the audio, but what I'm going to do now is pretend I'm playing in the cricket field or in baseball. I'm going to make my hands large. I'm going to place my kneecap between my thumb and my hands as I slide my pelvis back. I'm grabbing my knees hard. I'm changing the shape of my back to reduce stress concentrations, to make myself as resilient as possible. Now watch, I'm going to push my shoulders away from my ears. I'm going to push my toes down and lean forward. And to stand up, I'm not going to lift with a slinky rounded back. I'm going to pull my hips through and stand up. Now, I just showed you the perfect deadlift form. Now, I happen to have longer legs and a shorter body. Another person would have longer arms, a longer body, and shorter legs. But that basic form of leaning into that perfect posture and then pulling the hips through is what many trainers are trying to achieve with a hip hinge, or pardon me, with a deadlift. So if that's the purpose of it, I would agree with your general sentiment. Is there a better way? So you can teach that form, but let's say the person has an ankle mobility issue, or they have a little bit of a beginning of an arthritic hip. To pull a barbell off the floor is not appropriate for them. Why not put the barbell up on blocks? Or better yet, why not, maybe it would be more functional and of greater utility for them, is to perform a golfer's lift. You can see my leg. I'm standing on my left leg. I'm pushing my right leg back so that my torso and my leg become one. I bend forward. I pick a load off the floor, perhaps a kettlebell or a dumbbell or something like that. It might be a cable. That might be a much better form to enhance their movement competency. So why was the weight on a barbell the diameter that it is? Well, some people will argue, well, that was rather arbitrary, and there's nothing magical of picking a barbell off the ground versus any other thing. My understanding was it was actually the size of the person's head that could fit under the barbell for safety reasons if the bar ever fell on them. Anyway, it's an exercise. I know I've got this reputation because of how YouTube clips have been clipped and edited. McGill hates deadlifts. Not at all. I've worked with some of the best deadlifters.
It wasn't a question to assess whether you hate deadlifts, but just thinking about the utility of exercises and the type of person who would be using them. I mean, it seems that if you look at the range of different exercises available to teach someone the hip hinge movement or to strengthen their surrounding muscles of the lower back or the legs, there are a multitude of other exercises which are far less complex and less risky and are easier to teach and train someone that also have a lower risk of injury. So when someone is starting out in the gym, the first exercise they do, likely, in my opinion anyway, probably shouldn't be a deadlift, because they're a person is just getting used to training their nervous system essentially to carry out potentially quite complex movements. So there's a higher risk of injury. So I myself, speaking from experience of having injuries more from ego lifting in the gym, I have now decided that I will never do a traditional deadlift again. And all the deadlifts I do are purely trap bar deadlifts. So my center of gravity is positioned differently and the weight is around me rather than in front of me. So there's less pressure on my lower back. That is something I've adapted due to personal circumstances. And I think people would benefit from similar things as well, because you get the same hip hinge movement from a trap bar deadlift, for example.
I agree with the way you've posed that commentary 100%. So there's nothing universal about a deadlift. There's nothing universal about the height that the deadlift is pulled from, but we've been one of the few. Probably we've measured more extension exercises in great detail than anyone else in the world. And we've been able to categorize the various types of exercises for their load on the spine, both in compression and shear, the muscle activation levels, the stability index that's required. So now we can match the very best exercise to that particular individual. If you have a history that lifting heavier weights re-injures your back, then of course it would be stupid to continue to do that. So the wisest starting form of a back extensor challenge would be a bird dog. It guarantees that you're creating what we call sufficient stability in the back. It activates in an isometric manner the back musculature, the gluteals and the hamstrings for hip extension, if the exercise is done properly. Some people lift the leg way too high rather than just pushing the heel away. The opposite arm is held out in front. The hand is squeezed. And then the stance hand grips the ground and is pulled down towards the feet, activating latissimus dorsi, really challenging the back. Now, when we look at the most recent science on isometric exercise, there's evidence to suggest it flushes out the inflammatory soup. And people have questions, well, why is this an effective exercise for people with back pain? I couldn't always answer that myself unless we measured they had joints that had lost stability, and the bird dog restored their stability. And we measured that. It would restore pain-free ability for an hour or so after doing it. And then it was actually Keith Barr of Berkeley that found this advantage to isometric exercise. If a person has knee replacement, they can't do a bird dog on the floor, so we do a standing variant. They put their hands on the edge of a kitchen countertop, for example, and extend one arm in the opposite leg. So there's quite a variation of technique where we can adapt that to help people with their pain. If a person is sitting for a while and they get discogenic pain and they have a dynamic disc bulge, I don't think the medical community appreciates how dynamic disc bulges are. If you have an open fissure disc bulge, like what I showed in the model, and you sit for a while, that bulge will actually grow. And that's why the person will report, oh, my left toe goes numb after 20 minutes. Okay, get out of the chair, stand up, reach for the ceiling, and you'll notice my low back extended. And as it extends, you can measurably reduce the cumulative stress in the posterior annulus and vacuum in the disc bulge in most people. Sometimes a tummy lay is much more effective at reducing the disc bulge. And then stand up again, interlace the fingers behind the head, bring the elbows around the front, and perform a squat. Do you remember the shortstop squat that we perfected the motion with? Now interlace the fingers behind the head and pull the hips through. That might be the most perfect equivalent of a squat or deadlift challenge for that particular person. But let's take a person who's interested in reducing mineral loss. Now, they have been told they have the beginnings of osteopenia. They're losing mineral mass, moving towards osteoporosis. A little bit of load through the skeletal linkage has been shown to reduce that loss. So do you see, I'm really stuck on this, Karan. It's going right back to your very original question. The pain is never nonspecific, nor is the biological process. Think of every system in your body. It requires stress for optimal health, even your psychology. But your endocrine health, musculoskeletal health, cardiovascular health needs stress. But in biology, there's always a tipping point. And that tipping point is determined by your parents, your training history, your injury history, your age, all of these things. And we try and best determine where that tipping point is, and then go and choose exercise tools, be it a deadlift or some of these other options to achieve the desired goal. And that desired goal, shown from the assessment, is different in every person.
So, Stuart, just I'd like to do a quick fire round of a few actionables and questions people may have. And often you see functional fitness coaches often talk about the benefits of hanging, dead hangs, for decompressing the spine as a, pain reliever and general reset of the back. What do you make of that?
It depends on the training volume of the individual plus their age. I'm going to give you an example. So for a younger person, it may not be required. You can be not a very skilled trainer and have great success with young people. There's a huge margin of safety and they heal quickly. I worked with the man who has the American deadlift record for men over 75. We had to decompress after every single lift to bring up his capacity to train. Otherwise, he couldn't train. And he would hang from a bar. We would also do some thoracic extension. But my point is, I've just given you two ends of a biological spectrum, and my answer has now changed. So we get right back to the individualness of this. So highly appropriate to hang. It's a very Eastern European, Russian strategy to increase training volume. For younger people, I wouldn't consider it. Remember the shortstop squat or that cricket style of squat? If you lean forward and use the arms as struts with the hands gripping over the patella, the kneecap, very hard, that is a traction. Doing a tummy lay. And as you breathe in and then exhale, image your low back relaxing or melting into the floor. That might be a much more effective strategy for someone with a disc compression driver to their pain.
And we often hear that traditional sleeping methods like futons, which have these harder tatami mats, can often be better for back health and a sleeping position than the soft plush mattresses and the ergonomic mattresses that we're used to in the modern world. Is that really the case, that harder is often better for most spines?
I'm sorry, I can't agree. And here's why I'm going to say that. Where in the world are futons popular? Where did they originate?
Eastern cultures.
Exactly. They came primarily from Japan and the South, into Korea and that band of the world. The typical spine from that region is much flatter, much less lordosis. So when we measure a lying on the back, when a person has a flatter spine, there's not much stress. If you take the average Caucasian or certain subgroups of the African spine together with size of the buttocks, etc., laying flat on the back now becomes a primary stressor. So when you look at the sleep literature, they will show that futons with the hard mattress for laying on the back, generally speaking, suit the Korean Japanese population. They will not be as popular and rated as comfortable as a European, Caucasian, and certainly some of the African haplogroups as well. So that's shown in the sleep literature. I will say that side lying, again, if we go back to that idea of the micro movement and someone who does have a specific loss of stiffness of a particular joint, when they lay on one side, and here's the test for your listenership. Do you see how the spine deviates in shear or cocks off one side when they lay on their side? Now, if they were to put a small pillow or a folded towel under their waist and align it, they will notice that the ache in their back goes away. Or another strategy might be push one heel away to turn the pelvis a little bit, put a pillow between the knees, etc. You're migrating that stress of side lying. And if they turn over and lay on the other side and the ache changes in location and character a tiny bit, we know that if we can bolster the spine and align it, we'll take the stress out. So that's more related to the type of injury. But when we get into the type of beds throughout the world, they suit the anthropometrics of that particular population.
Now, Stuart, you've been studying and analyzing spines for over 30 years, and you're a wealth of knowledge about when it comes to back health. Can you tell me more about your book as well?
Well, I've written several. As you know, I've written low back disorders for my medical colleagues, which describes in great detail how we go about assessing and the various tests and the techniques used and whatnot. But I'm afraid it's a little bit heavy for the lay public. So they asked would I write a book to guide the lay public, and it's called Biomechanics. It guides the reader through a self-assessment of their pain, points out to them what activities cause their pain and what activities take their pain away. And then the book guides them through a strategic retuning of their body in terms of stability and mobility and various exercises to do so to get rid of pain. So that's Biomechanics. It's only for people who are experiencing pain. It won't get you to the Olympics. And then there's another book called Ultimate Back Fitness and Performance, which then picks up, assuming that you've been successful in reducing your pain, and then it's now time to train. However, it recognizes your injury history. The rules have changed a little bit, and now it guides you through to getting back to the fun and joie de vivre of life.
Well, Stuart, thank you very much for sharing all your wisdom about backs. And I think this is something that more people should pay attention to in their everyday life. So thank you very much.
Oh, well, I'm going to be formal. Dr. Karan, thank you so much for what you do. I've seen quite a number of your videos, and thank you for what you do for the public as well.
Thanks so much.